Hello, my name is David Trimberger, and I am answering the Module 3, Question 3 discussion question. So we are doing another scenario of creating our own cardiac event, and we have to describe a background, we have to explain recognition as well as signs and symptoms, and then eventually how we would treat it, and then a pathophysiology. So, starting off, here is my story that I made. So, you are dispatched to a 57-year-old female with a chief complaint of dizziness, pounding chest, and shortness of breath. You are met by the patient's son, who is explaining that his mom was cooking in the kitchen when she lost all the color in her skin, and she began to not be able to catch her breath, and her chest began to start to hurt. You and your partner get an initial set of vital signs of a pulse of 140, a respiratory rate of 20 and labored, a blood pressure of 90 over 70. Your patient explains that she became very faint and experiences dizziness and nausea, and she feels she cannot control her heart rate. You attach a 12 lead to her, and you discovered a very rapid but stable rhythm with a regular wide QRS that appeared to almost have a twisting peak appearance. So at this moment, this is where I'm to tell you to pause the video and post in the comments below how you would treat this patient. And here in a moment, I will explain how I would take care of this patient. Okay, so first off, we need to go over recognition. So after you have established the 12 lead, you would then begin to recognize that your patient is going through torsades de pointes. The way that you're able to determine this is because of she had the low blood pressure, the high heart rate, she was dizziness, and all this other stuff kind of helped to give you that little mentality of, okay, maybe something's off and going on cardiac wise. So you establish a 12 lead, which is the main way how you can be able to diagnose this. And you notice that it's torsades because it's a stable rhythm, but it's irregular, has a wide QRS, and it can also be known as polymorphic. That just meaning that it changes a lot and it looks like these twisting peaks of just going back and forth. So the way that I would take care of this patient is I would rapid transport. I would monitor them every 5 minutes, taking a new set of vital signs, going on to the hospital. I would administer oxygen to help alleviate cardiac demand on the heart, as well as allowed to be able to help with the shortness of breath. And then I would also start an IV line. Once I have all these established, I would administer magnesium sulfate. Magnesium sulfate should be administered slowly to help minimize side effects. And say if your person was unconscious and you administer magnesium sulfate, you need to make sure that you check their muscle tone for cramping or other signs of hypermagnesia. If hypermagnesia does occur, you can use calcium salts as an antidote to help try and alleviate what is going on. When you administer this medication, your patient may begin to experience bradycardia as well as a respiratory rate depression. Next, I'll be moving into the pathophysiology. So torsades is caused by a reactivation of calcium channels, and it can also be caused by reactivation of delayed sodium current or a decreased outward potassium current. All of these result in an early after polarization, which is what causes that polymorphic and rapid QT interval. Thank you for listening. This is my discussion response. Thank you.